Kurumzari, and thank you, Madam President. I'm Santa Kurai, an indigenous Nupi Manbi from Manipur, a region of India where LGBTIQ plus indigenous identity are largely isolated by the lack of understanding of sexuality and a strong regional heteronormative narratives. We welcome this discussion on the situation of human rights of indigenous peoples facing the COVID-19 pandemic. It is crucial to ensure the inclusion of indigenous people in state COVID-19 recovery and post-recovery plans. We firmly believe that any proper response to the pandemic should be incorporate an intersectional approach considering the diverse issues faced by indigenous persons. Across the world, indigenous LGBTIQ plus people have experienced added challenges in accessing essential healthcare during the COVID-19 pandemic. For instance, they have faced discrimination in vaccine distribution alongside stigma and structural marginalization. In addition, the pandemic has been an opportunity for anti-rights groups to continue scapegoating sexual and gender minority. LGBTIQ plus indigenous persons have been stripped down of their rights, such as freedom of assembly and access to economic opportunity. For example, in Manipur, there is an existing transgender Samani community, Nupa Amaibi, threatened by colonial subjugation. We depend on water resources such as fishery, livestock, and hygiene industry that have been impacted by development projects in combination with the challenges introduced by the pandemic. This has led to poor water management, waterborne diseases, and natural and man-made calamities affecting our physical and mental health. We call on state to take action involving LGBTIQ plus indigenous people when elaborating public policies for the pandemic response, implementing an intersectional approach that considers their realities and current challenges. We also recommend that the United Nations engage in a sustained dialogue with indigenous peoples and community, particularly in terms of sexuality and gender identity. I thank you, Madam President.